Welcome to this month's issue of The Ophthalmologist. I hope you enjoy it. This month's editorial is about the battle for hearts and minds. So I think it's generally accepted that if you can postpone the development of age-related eye disease, that's of great financial benefit to society and healthcare systems because you're postponing disability and costs of intervention. And AMD is a great example of that, although of course we can intervene really only in wet AMD with drugs like anti-VEGF agents, whereas patients with people with dry AMD are somewhat out of luck at the moment. Really, the only current way that you can postpone it is through nutrition, and so there's a lot of work that has been done in determining what dietary supplements or components of the diet actually help prolong decent vision and postpone the inevitable onset of age-related eye disease. We have an article by Cecile Delcourt in this month's issue that addresses that. But statins are in the news an awful lot at the moment. Now that's opposite because statins have been associated with a postponement of dry AMD. There's studies that show that, or at least indicate that. And there's rumours of the next generation of statin-like drugs, cholesterol-lowering drugs, being evaluated for postponement of the development of dry AMD also. But statins are in the news an awful lot at the moment, and that's because they're given to an awful lot of people these days. Current NICE guidance in the UK means that almost 11% of the UK population could potentially have statin prophylaxis these days. It's partly a function of an ageing population and the relative safety profile of these drugs. Statins are rather safe as drugs go, but of course at the population level you do get side effects and they begin to stack up, and so you got to the point where, should all these people be getting statins? But yeah, surely they prevent a lot of heart attacks and other related problems to thromboembolism and arterial and atherosclerosis. However, the side effects do stack up, and the press are picking up on that. And so there's now enough of a debate within the medical profession that tabloids like the Daily Mail are reporting on it, and they seem to be almost genetically predisposed to dislike population level medication. Now, so the big picture is that a lot of people are here now because of statins. The big picture could be that a lot of people will have vision for a lot longer because of statin-like or any other drug. But the issue is, if we had a drug to prevent the development of AMD by 5-10 years, and everybody had to take it because, not everybody can have optimum nutrition throughout their lives, the side effects will stack up. If the drug isn't as friendly and as relatively safe as statins, this is going to be worse. So you can see that the press might have a problem with that. So it could be that the intervention is totally worthwhile, but it could be also that patients don't want to take it. And so the battle, therefore, is not really in terms of the medicine, it's in terms of the press. It's really a battle for hearts and minds. Hope you enjoy the rest of the issue. Thanks.